Well, good afternoon, everybody. Thank you so much for joining today's VetNet session, Stronger Together, Suicide Prevention and Support for the Military Connected Community. I'm Linda Nellis. I'm the Alumni Service and Engagement Coordinator at the Daniello Institute for Veterans and Military Families. And we're honored to have you with us today for this vital conversation centered on mental health and suicide prevention within our military connected communities. Today's session will begin with insights from Erin Milius, IVMF's Community of Practice Program Manager, who will also guide a meaningful discussion. So today we're privileged to welcome Gara Lloyd-Lester, the Coordinator for Community and Coalition Initiatives at the Suicide Prevention Center of New York Office of Mental Health. And they will bring a wealth of knowledge and compassion to this conversation, and we're really grateful for both of their contributions. So at this time, Erin, I'll go ahead and turn it over for you to share an overview of community service resources available to support this mission.
Hello, yes, thank you, Linda. Like she said, my name is Erin. I'm the program manager of the Community of Practice here at the IVMF. Essentially, what that means is I work with communities throughout the United States that do care coordination for veterans and their families, essentially sharing best practices and coming up with sort of a unified voice for policy and advocacy as it relates to veterans around care coordination. Most of the organizations in our community of practice essentially are using technologies to connect veterans to resources and services, essentially working to shorten the time to services for veterans, and then also increasing access to resources. So a lot of when veterans talk about the different needs that are out there, one of the most overlooked ones is actual care coordination. Veterans know that there are services out there, and there are a plethora of them, but they can be difficult to navigate. So care coordination is essentially probably one of the top 3 needs for veterans as they help navigate all of those intricacies and services from the VA, the VBA, all the way down to, small local CBOs that are out there to serve veterans, and just knowing where to look and how to look for those services. We do that through the community of practice and sort of our care coordination efforts. And also what we do in terms of the community practice is provide education on how communities can start doing care coordination. A lot of them are doing it, but they're doing it rather informally, and we're looking to help teach those organizations how to formally use technology to increase access to services and resources for veterans. So that's big picture sort of what I do here at the IVMF. And with that, I will let Gara introduce himself as a member of this panel.
All right, and I'm going to just interrupt quickly, Erin. I'm so sorry, but I do see that we have Kyle Thompson with us as well. So thank you so much for joining. Kyle Thompson is Vice President of Local SEIU Union Safety Representative, Certified Peer Specialist, Healthcare for Homeless Veterans, HCHV team member, and Mental Health ICC. So thank you so much, and I'll pass it back over to you, Erin. Thank you so much.
Okay, thank you. Do you want to have a chance to introduce yourself as well, Gara?
The unmute button there. Thank you, Erin. So good afternoon, everyone. My name is Gara Lloyd-Lester. As noted, I work for the New York State Office of Mental Health's Suicide Prevention Center. We are located physically. Our main offices are in Albany. I work out of Syracuse and have had the good privilege of working with SU and the Institute in the past with some other events. I'm currently actually sitting in an office space in Troy, New York, because part of my role is statewide in nature. I have the good fortune of working with local suicide prevention coalitions to develop the capacity and the infrastructure to address suicide on the local level. And also since 2019, have been leading the Governor's Challenge to Prevent Suicide among service members, veterans, and families. So a lot of that work has been focused in the intersection of specifically lethal means safety, and our work in New York State has focused on the F part of SMVF, family members. So I'll be able to perhaps talk and share a little bit about what that work has looked like. And another part of my role We're also helping to support and amplify what is referred to as onward ops, which is helping to look at supporting transitioning service members from active duty military to civilian life. There's research that calls that transition period the deadly gap. And it sort of makes sense that transitions can be hard when you go from active duty to civilian life. What's purpose? What's the mission, right? And so Onward Ops is something that's a national program that I've been involved with, helping support some through our agency, some funding to different communities to stand that up. It's a great resource to support individuals, and I think sort of falls into the broader category of connectivity to local resources. So I can talk more about that in a little bit. Thank you for the opportunity to be here. This is September 30th, the last day of Suicide Prevention Awareness Month. What a great way to cap that off.
Yes, thank you, Gary. And Kyle, anything else that you would want to add that Linda may have left out before we start?
No, she covered them. She covered a lot of it and then some. She threw my union hat in there as well.
Well, nice. Well, then with that, we'll sort of transition into this conversation. And I'm going to go a little bit out of order because what you just mentioned, Gara, about the transition piece. And here's a question that we have related to: how are transition periods like leaving active duty or returning from deployment being supported to reduce the risk of suicide among veterans?
And so one way, and I'm sure there's multiple ways, but one way is through the Onward Ops program. If you're not familiar with it, as with anything these days, Google it and it should come up. But it was founded from Joe Geraci, who's retired infantry, now works at Columbia University, who understood the risk and the vulnerability of transition, right? Especially from active duty to civilian life, but to your point also, right, from deployment. And he recognized that there was a gap, right? That one day you're a soldier and the next day you're not, and it's sort of a clear delineation. And oftentimes there's not supports and services in the community that you're going back to help with those transitions. So Onward Ops is a couple of different things. There's a dashboard, so that's the technology behind it. And then there are trained sponsors or mentors. They use the term interchangeably, right, for in your respective community. Now, not every installation and every community has this, but in New York State, there's probably about 15 or 20 of these in different counties, where if you're a transitioning service member from any place in the country and you're coming back to Watertown, New York, where Fort Drum is, right? You can get connected before you leave the military with a trained sponsor or mentor, and you can tell them what are your needs: financial, housing, education, mental health, so on and so forth. You can do it solo, meaning you can access all of the resources yourself, or you can do it co-op, which is to have that like in-person mentor shepherd you through that process 6 months prior to leaving the military up to a year afterwards. As part of that, because we know that that transition, that gap, there's an increased vulnerability for suicide. Everybody who signs up for Onward Ops goes through the brief Columbia Suicide Severity Rating Scale. And if you score beyond a certain threshold, you automatically get connected to behavioral health, right? And so it's trying to capture people at a vulnerable time period and get them connected, so it's not just like, good luck, here you go, thanks for your service, and into the respective communities. And so we have funding through my agency to support a number of those. They call them CICs. Across New York State. Not every county has them, but we are looking to expand them for the few counties that don't. It can be a great connective tissue from that active duty to civilian life.
Thank you, Gary. Anything you would like to add, Kyle?
No, he crushed it.
Yeah, and to be fair, I'll add, just reinforce a lot of what you said. That navigation of resources is crucial during that time period, to be able to, to successfully enter into somewhere into the service provider space during that time, so that you're not having to navigate this journey alone, this service navigation journey. And like a lot of what we do at the community of practice and through our care coordination efforts is to make sure that you have a locally trained expert in your community able to take that journey alongside you. So like oftentimes when you're searching for services, you hear no a few times, and then you sort of just end that navigation journey. With this, you get somebody, either it's a mentor or a care coordinator, that's willing to walk that journey with you. They'll, at least in my experience, when in our care coordination, those no's are heard by the staff member and not by the veteran or the service member. You know what I mean? We're always looking to get that veteran to the best resource the first time, eliminating a lot of those no's, and then encouraging them to access services and be a little bit more proactive than waiting for something bad to happen. Like most of the grants that are out there for veterans, it's when you hit that rock bottom part, and we want to get out ahead of those things. And transition is that crucial piece and that crucial time to sort of navigate those resources, enter in the services, build familiarity and rapport with those service providers too. Oftentimes, if you do it alone and you hear no the two time, you're going to give up this because you're saying that the system doesn't help you or it's not there to support you. And that only expounds the mental health issues that you may be transitioning with too. So getting connected with a mentor or a care coordinator back in your community who's an expert in that space is crucial, I believe, too, as well. With that, I guess we'll go back to sort of a broader general question. How do you best support an individual navigating mental health resources? You want to go ahead and take that, Cal?
Sure. I guess it's tricky. If they're trying to, it depends if they're a crisis or not. It varies. But if you have someone who is generally like wants to get into mental health therapy or start mental health services, the VA has a very good mental health program that they have. And there's also the vet center too, which also has a very good mental health program as well. Both of those serve the veterans. There's certain criteria to get into the vet center, and they're a little bit separate than the regular VA. They don't report to the regular VA. So sometimes a lot of veterans who don't, maybe let's say, for example, they don't trust the VA, but they are willing to go to the vet center because it's not affiliated, I should say, with the VA mental health side. But in order to best support them is honestly listening to them and hearing what their needs or wants are and trying to guide them and give them the right resources for that, and whatever that is. If it's substance use, listening to that. If it's mental health and substance use, it's a very fluent situation when it comes to veterans who are trying to navigate the mental health resources. And there's an abundance of them out there. There's Helio Health too. There's a lot of community providers out there that work well with veterans, whether they're eligible for VA services or not. And that's also another tricky thing that throws it into. There's a lot of veterans who are not VA eligible because of a type of discharge they received, but still were deployed or have some mental health issues from their time in the service. And so now you have to use those community resources such as Helio Health and other ones that are out there to help. They have that Fox one now too, which is great. It's a wonderful thing. So I think, long story short, the best support that you can give to an individual is going to be a case by case situation, and just listening, I say, is the best support. Listening to them, hearing what it is that they are expressing their needs are, or what that is that they're trying to get help for, and then helping to provide the best resources for them to make the option themselves.
Thanks, Kyle. Before I hand it over to Gary, I'll probably just add to that is sort of, as the veteran, is identifying what mental health supports best suit you. Some people, talk therapy is, there's more things out there than meeting with a psychologist or a psychiatrist and talking through your problems. There are options as it relates to service dogs, equine therapy, other mentoring programs, or being proactive in avoiding a lot of those mental health issues by getting you connected to organizations, whether it's like a Team RWB or a Mission Continues, that sort of help you get connected to the space, get connected to those who serve with the same purpose, and identifying, those kind of things that bring out some of those mental health issues in you, and understanding that maybe if you went through talk therapy the first time and you didn't find it valuable, that isn't the be all end all or the ending of it. There's other options out there for you, and to continue to try to address your mental health through as many of the different organizations or possibilities as there are out there. Like I said, I say that to veterans all the time. They're like, well, it didn't work. And I'm like, well, maybe that wasn't the best course of action for you. Let's explore other different options that may best suit you, to give you purpose and meaning and sort of help you deal with some of those mental health struggles with your service, or just the mental health struggles in life in general. But yeah, it's, like I said, I understand being knowledgeable of those resources and listening to the veteran in terms of what they think is best for them, and sort of not in guiding them through their needs, not through what you think is probably best for them at first. You want to go ahead and add anything to that, Kara?
Yeah, I think just reinforcing what you said, I find managing expectations from the beginning. I would love to believe that everybody's first time interaction with the behavioral health world would be positive and right, life affirming and all of those good things. We'd like to believe that maybe. It's not linear, right? So I think letting people know that this might not, like you said, the first time might not stick, you might not have a good fit, but that there are more than one options. I think that can be crucial. And just reinforcing, like listening. Sometimes if you can ask somebody, what do you need? They don't know what they need, right? Like they know that something's going on. And if you ask the question, well, what can I do to help? Or how can I help? They might not know. So being willing, you know, each situation is unique, but being willing to give a little bit more guidance or direction, but other times sitting back and asking the question. And if you don't know the answer, I don't know the answer, but let me try to find out, right? I think that can all be helpful, right, on a case-by-case basis.
Gotcha. Thank you. And we'll go ahead and jump into another one of these questions. What do you feel are the most underutilized resources currently available to veterans struggling with mental health? And then how can we better promote them? We'll start with the first part of it. Like, what do you feel is the most underutilized resources currently available to veterans struggling with mental health? And that's up to either of you two, whoever wants to jump in.
Underutilized
Yeah.
services for veterans. That's a good question. I think I don't think the VA is promoted enough, I should say. I think it's really hard. Veterans, I'm a vet myself, and I never really knew anything about the VA until I started working at the VA. Had I never worked at the VA, I probably would have never really truly understood all the services the VA has to offer. They did an hour-long snippet in my transitional class, and that was it. It just said, go register. This is how you register. Go to your facility. This is blah, blah, blah. Very small, very short. So I think the VA is underutilized. I think a lot of veterans don't really know what the VA truly has to offer. They hear bad stories, and then that's all they hear, and that's all they care about. But I do think the VA is underutilized and could be utilized more with a lot more advertising and a lot more promotion of the services.
Thank you, Kyle. You have anything, Gara?
Yeah, I think so. Recognizing that there are a couple of different schools of thought in terms of how many veterans die a day. 22 is a number that's been around for a while. A little bit more recent numbers would suggest 20, depending on how you're sort of calculating things. But regardless, far too many veterans are dying by suicide. But we know if we use 20 as the number, of those, roughly 16 of those are not connected to the VA at the time of their death, which means these are veterans living, working, playing in our communities, right? So for whatever reason they're not connected, I think like we need to make sure that they are aware of some of those other resources, formal and informal. Some people, like, they have a faith tradition. So are our faith leaders in a given community culturally competent? Like, do they understand what it's like to have worn a uniform, right? Joseph P. Dwyer peer-to-peer program. Every county in New York State now currently has access to the Dwyer program. Non-clinical, it's peer-to-peer, and for many, that's going to be the connection. That's going to be the connective tissue, right? That might then be able to connect you to other resources in that respective county, right? Each Dwyer program is a sort of a snowflake, if you will, right? They all look similar. They all have they all have some similarities, but they all are unique based on the county. I think some of this conversation to me is also like, what are we doing to inform different community members and caregivers that want to support veterans, that want to work with veterans? Just because you have this desire doesn't mean that you're equipped to do it in a way that's culturally competent. So I think, like, for me, part of the conversation probably beyond the bounds for today is how do we help educate those individuals so that they can, you might only get one chance to connect with somebody, right? Because if that goes south, maybe that person's not going to reach out again.
Yeah, and I agree with that 100%. And I was going to take it back. Well, first thing I would say is that with the underutilized piece of it is those social connections, those social enrichment organizations that allow you to have someone to talk to and connect with. And then I would take it back to sort of what you said and echo. Big picture is being able to openly talk about mental health, suicidal ideation, substance abuse, depression, and anxiety. And with those two things, there's mental health first aid for veterans and QPR training, which is question, persuade, refer. And like I said, having as many people as possible sort of enter into those programs and get those certifications. They're mostly free in your communities, almost in every instance, is that you can go ahead and receive those trainings, even as a veteran or as a community member, or those faith-based organizations, to be able to openly and talk about these things when they do come up. I think a lot of times, a lot of people, I can sell somebody struggling, but I don't know how to help. And the more that would be for me the most underutilized piece is having as many people as possible trained and being able to openly talk about these things. So when the instances do come up, you have that knowledge and that power to be able to assist. So I think big picture, the most underutilized thing is just some of those big trainings that would best allow any community member to be able to step up and help deal with anybody struggling with any kind of mental health issues. So with that, we'll move to another question that we have here. What partnerships exist between the VA, nonprofits, and local communities to create a more seamless support system for veterans in crisis? And where do you think the gaps are?
Well, RVA locally here in Syracuse is partnered up with a lot of the great organizations, nonprofits, Clear Path for Veterans, the Red, White, and Blue, and at every VA event, Clear Path for Veterans, they're all there. All the nonprofits that we are affiliated with are there, and I think it's great because it's really giving another set of resources to veterans to help continue that, because the VA is not there all the time, it's good to have other outside resources and communities that help, especially with social integration and community integration in these events out there that get veterans out, seeing other veterans and meeting them. And and ClearPath is part of that Dwyer program, if I'm not mistaken. I think that Sergeant Fox one.
Yeah, like I said, I would echo that too as well. That with the passing of the Staff Sergeant Fox grant, it definitely helps to facilitate those connections between community-based organizations and the VA as it relates to suicide prevention. As they're working sort of now hand in hand now to ensure that veterans have streamlined access to the VA, and you can walk into any community-based organization and sort of access the VA in a lot of those services. And a lot of those nonprofits are really good at filling gaps. The VA provides tons of services, but it can't provide every service. So those community-based organizations are there to help gap fill as best that they can. And like I said, this question alone is very near and dear to me, is because we do care coordination, being able to use technology, and a lot of the VAs, not every VA in all our communities have adopted it, but those who have seen more increased referrals into the VA systems. We've seen the VA social workers now being able to do their job, meet more veterans, and let these care coordination places sort of navigate those community-based organizations and sort of be the conduit from the VA into the community. So any place or any community that has care coordination, there's lots of research and evaluation and studies coming out from Northwestern and the University of Pittsburgh, sort of showing that those VAs that collaborate with community-based organizations are showing, increased overall effectiveness in services, a decrease in spending on veteran healthcare because they're getting connected to community-based organizations. So these things are sort of happening, especially in areas that have formal care coordination centers where veterans are being connected to the community through the VA, through local experts in the community. If you want to add anything, Gara?
Yeah, I think that like a lot of my role in general, not specific to Service Connected, is working with community partners through the VA. Probably some of you are familiar with CEPCs, Community Engagement and Partnership Coordinators. Every VA hospital has a suicide prevention coordinator, more of the clinical aspect of things, but the CEPCs are meant to go into the communities and to help develop coalitions with a veteran focus, right? That parallels the governor's challenge focus areas of connection, screening, and lethal means safety. New York State has some amazing CEPCs that I work with on a regular basis. They have a lot of flexibility of what they can do within their role, and can bridge some of those formal and informal VA and non-VA partners, right? They're in and of the community. Myrick 19 has the ability to support community clinicians. I'll put this link in the chat, I think, to support clinicians that aren't VA but are working with a veteran, and just they don't quite know what to do or how to navigate that. So as a clinician in the community, you can request that consultation. Every county in New York State has a director of mental hygiene who's responsible for mental health, substance use, and developmental disabilities in their county. While they're not specific to veterans, they're anybody in their community, so they can be a great connector and convener to services, especially if this is a veteran that isn't connected to the VA. The last thing I'll mention is care coordination is a thing, right, in the mental health world, probably similar to how you would describe it and define it, Aaron. There's eligibility for it, but basically, people, whether they receive, it's intended for people on Medicaid, right? So they're right, but private pay too. If you have certain conditions, you can get a care coordinator, and it's what it sounds like, to connect you to resources, right? To help you navigate the waters. It's not perfect, but it is an option for folks that maybe, for whatever reason, aren't connected to the local VA.
Gotcha. Linda, we have time for one more question. All right, then we'll go ahead with this last question that we have here that I think is interesting. What gaps do you see right now in technology-based suicide prevention efforts, and where could innovative tools make a difference?
I'll be perfectly.
Yeah, go ahead, Gara.
Right. So probably in the portfolio of stuff that I work with, technology, I have the least interaction with, other than I see a lot of articles and a lot of research on it. I see AI, of course, probably is something that is much more on people's mind recently as a possible tool. It's also the Wild West as it comes to both regulation and how it's used. I think for me, the question is, what are the opportunities to use technology in a way that's supportive, that increases effective, efficient connection to help, but also not to rely on it, right? So I'm not answering the question probably in a satisfactory manner, other than I think there's definitely some great tools out there that I've heard about, right? There's another funding opportunity from the VA called Mission Daybreak, and they've actually a lot of the funding for those are for startups that's looking at how to use technology to support veterans. Some really cool stuff out there. Some of it's in the pilot phase. I think for me, it's a matter of how is it being used in a helpful way to support people, but let's not rely on it. There's still the human equation, the human element to helping somebody. So probably an unsatisfactory answer, but I'll just end it there.
You have anything, Kyle?
Yeah, I mean, good points, Gary. It's especially with AI coming out now. A lot of people use AI for a lot of things. I know some AIs actually have a thing where they literally have like, it'll say, I'm feeling anxious. Like it's a selection you can make, and you talk to this AI person about what you're feeling and the anxiety that's going through your mind. I have tested it out. Like I wanted to see what it was like. Pretty decent responses. It's almost like you're actually talking to a therapist, but there's a lot of things that go behind that. But the responses back are pretty something that you would see or hear. But I think what gaps that we have is actually education on technology. To be honest, I work with a lot of individuals and a lot of veterans that are older. So technology, especially with everything that's going on with all these smartphones and things, they are very not, they don't know how to operate these things. So the VA is really moving towards being more up to date with technology, and it's leaving behind that older generation. They're really not, so I think a big gap is the education behind it. I think that I would like to see some classes out there teaching older veterans on how to use this technology and what it can be used for, because a lot of veterans are not technology savvy, and so they're eventually their healthcare does fall behind because they don't know how to do text messaging, and they don't know that they're receiving these appointment reminders, and they don't know about checking when their appointments are, or even requesting a refill on their medications. So I think there's a gap in between education of technology nowadays.
Yeah, that's a good point for sure. The education piece, especially as someone who's done care coordination with older veterans, using a technology platform to connect them, there was a lot of difficult in terms of buy-in and the text messaging piece and just the overall technology piece. But I think some of the efforts that have gone well are, telehealth in terms of rural veterans, those who don't have transportation. If you can be educated and are willing to do telehealth, then it saves you a lot of time, of energy, of traveling to the VA. It should help with the connection of rural veterans into services as well. But yes, but before that happens, the education piece has to happen as well, to get those veterans, up to speed on the use of technology. But I think it can be effective just in generally as it relates to, connectiveness and, getting to services from different areas that aren't necessarily close to the VA. And with that, I think we are done with our questions. Linda?
Thank you so much, Aaron, Gara, and Kyle. This was really an amazing conversation, and I hope everybody who attended found it helpful. We will be sending out an email with the recording to everybody this afternoon. So again, thank you so much for attending, and thank you for all of your participation.
Thank you, everyone.